Hello friends, myself Dr. Prabhat Vagamsi, Director Shraddha Hospital Management Solution and also NBQP Certified Hospital Consultant. We are going to discuss medication error in hospital, how to identify them and prevent them. So let's begin the journey. Medication error in developed countries of primary concern, where there is a question of adversity to a patient's health. But in developing countries like India, it's just a term and its significance is undervalued. The incidence of medication error is essential to estimate the proper medical care provided in the healthcare system. Based on the article published in Indian Journal of Critical Care, September 2020, let me share the few facts. Out of the total 6,705 charts reviewed, 410 medication error were found, which makes 6.11%. Transcription error is to be at peak with 44.1%, followed by prescription error 40%. And administration error 14%. The incidence of indenting is 1.5% and dispensing error is found to be very low within 0.2%. Thus the commonest type of error is transcription. Now let's start from the base definition itself. As per the National Coordinating Council for Medication Error Reporting and Prevention NCCM-ERP, a medication error is defined as any preventable event that may cause or lead to inappropriate medication use or patient harm which the medicine is in the control of the healthcare professional, patient or consumer. The different types of medication error includes prescribing errors, transcription errors, dispensing errors, administration errors, documentation errors, monitoring errors. Now let's understand each in detail. Prescription error, wherein the selection of a drug is incorrect based on the patient's allergy or other indications. Additionally, the wrong dose, form, quantity, route, oral or intravenous, concentration or rate of admission could be used while prescribing the medicine. Other concerns are use of unauthorized abbreviations, illegible handwritings, incomplete prescriptions. Next one is transcription errors, defined as any discrepancy between the physician's medications order and medication order transcribed onto any document related to patient concern as the medical records, medication chart, medication request sheet or discharge medication chart and or any other similar documents. Next one is dispensing error. A dispensing error is a discrepancy between a prescription and the medicine that the pharmacy delivers to the patient or distributes to the ward on the basis of prescriptions, including the dispensing of medicine with inferior pharmaceutical or informal quality. Next one is administration errors. Omission error, in which there is a failure to give a medicine dose before the next one is scheduled. Wrong time errors, wherein a medicine is given outside the predefined interval from its scheduled time. 15 minutes plus or minus can be omitted as error. Wrong dose error, where the correct dose was prescribed but the wrong dose was administered. Inappropriate administration technique errors such as administering the medicine intravenously instead of orally. Wrong dose prescription errors, where a medicine is incorrectly formulated such that too much or too little diluting solutions added when a medicine is reconstituted. Next one is documentation errors. Failure to document a patient's medication administered or anything else related to patient's medicines. Documentation of medications, but dosage not administered to the patient. Next one is monitoring errors. Monitoring errors such as failing to take into account patient's liver renal functions, failing to document allergy or potential for drug interactions. Medication error risk factor includes high volume, poor handwriting, inexperienced staff, challenging patient population, lack of follow-up, lack of appropriate monitoring, lack of policy enforcement, medically complex patients, medication requiring calculations, poor communications, shift work in the hospitals, workplace culture, verbal orders where it is not getting documented, interpersonal factors such as external stress, language problem, serious harmful results of a medication errors also there, which may include hospitalizations, disability, life-threatening situations, death, and many a time birth defects. There are few ways to reduce medication errors. Before drugs are approved for marketing, needs to review the drug name, label, packaging, product designs to identify and review informations that may contribute to the medication's error. Route of drug, tablets, oral syringe, and other dosage forms should be have distinct and legible imprints, codes so healthcare providers and consumers can verify the drug products and strength. The package design should protect consumer against incorrect use. But at hospital setup, what we can do, let's discuss. The first is storage. LASA list, that is look-alike, sound-alike list, and storage to prevent error between two similar packaging and name. High-risk medication list with special storage to alert nursing staff and doctors to register acknowledgement in mind about the severity of medication usage. Next one is transcription. Medication document should be countersigned by GDMO or nursing in charge or departmental in charge, especially critical units and parts. Next one is administration. There are 6 rights: right medicine, right patients, right dose, right time, right route, and right documentations needs to be followed. Next one is audit and training. Audit of documentation and continuous training to sensitize the staff regarding alertness toward medication errors. So, what are the takeaway points to prevent medication errors from this video? Besides signing the prescription, always circle your name on the pre-printed prescription pad. Do not hesitate to check the dose and frequency if you are not sure. Always consider the fact that each medicine has a potential for adverse reactions. Do not use drug abbreviations when writing orders. Always add the patient's age and weight to each prescription. Check for the liver and renal functions before ordering any medications. Spell out the frequency and route of dose. Do not use abbreviations. Always specify the duration of therapy. Do not say give out XX number of pills. Write down 101, 111 or 010 instead, writing out the number of pills. Always be aware of high-risk medications. When writing the prescription, state the conditions of being treated. Hope this information will be useful to prevent medications errors. You can also share your experience to comment sections regarding the medication errors. Thank you very much. Do not forget to comment, share and subscribe to do your best academic check. Thank you very much.